welcome to the deep dive. Today we're diving into something that's really common. Dental fear. Anxiety about going to the dentist.
Yeah, it's a big one.
Totally. Whether it's just like mild nerves or full-on avoidance, if that sounds like you or maybe someone you know, then this deep dive is definitely for you. We're going to try and unpack some of the reasons behind it and look at some real practical ways to feel a bit more comfortable with dental care.
Right. And to do that, we've been listening to this really interesting conversation. It's from the Bangkok International Dental Hospital podcast. It features Dr. Paworn, who's a senior consulting dentist there, and Sarah, an expat living in Bangkok. And she's really open about her own dental fears.
Okay, so a real patient perspective, too.
Exactly.
So our mission today is to pull out the key insights from their chat. We want to, tackle those worries people have, maybe shine a light on the solutions available, and hopefully leave you feeling, well, a bit more positive about looking after your teeth.
Sounds good.
Okay, so Sarah kicked things off with, the absolute #1 question, didn't she? The one everyone thinks, will it hurt?
Yep, the big one. And what's immediately quite reassuring is Dr. Paworn's answer. He really emphasizes how much things have moved on in dentistry.
Right. It's not like the old days.
Not at all. He talks about, modern techniques, specific technologies designed to minimize any discomfort, and of course, really effective local anesthesia.
Okay.
So treatments are generally much gentler now and often faster, less invasive than they might have been in the past. It's much more patient-focused.
That makes sense.
Yeah.
Sounds like they're really trying to make it easier. So then Sarah brought up another major thing for anxious patients, sedation. She asked if that's actually an option.
Yeah, and this really shows how dentists are thinking differently about anxiety now. Dr. Paworn explained that at their hospital, BIDH, they offer a whole range of sedation options.
Oh, really? Like what?
Well, it goes from a mild oral medication, like taking a pill beforehand, right up to full IV sedation.
Oh, wait.
And the key thing he mentioned is that it's tailored. They figure out what level you need to feel comfortable.
Right, so it's personalized.
Exactly. And they have, registered nurses involved, a certified anesthesiology doctor for the deeper sedation. It adds a big layer of safety and reassurance.
Yeah.
So you really can be properly relaxed or even, asleep during the whole thing if that's what's needed. Options range from just taking the edge off to being completely out of it, essentially.
That must be a massive relief for people with, a real phobia.
Yeah.
Sarah also mentioned something else I bet a lot of people worry about if they haven't been in ages, the fear of being judged.
Oh, absolutely. That feeling of embarrassment, right? She was worried about what the dentist might think or say because it had been years.
Yeah.
And this really touches on that crucial patient-dentist relationship. Dr. Paworn's response was, I thought, really important here.
What did he say?
He was very clear. They have a completely non-judgmental approach. They regularly see patients who haven't been for 5, 10, even 20 years.
Wow, okay. So it's common for them.
Very common. He said their focus is just on, okay, what do we do now? Moving forward, making a plan that works for you. They even bring up the anxiety issue proactively right from the first contact.
What do you mean?
Like whether you call or email or just walk in, they're trained to kind of check in about anxiety levels and reassure you right away.
That proactive part sounds really key. Just creating that safe space from the get-go.
Definitely.
Sarah also asked if she could bring someone with her, for support.
Yeah, and Dr. Paworn was really positive about that too, which again highlights how much they value sort of emotional comfort.
Right.
He said, absolutely, bring a loved one, bring a friend. It's totally fine, quite normal actually.
Yeah.
And they have private consultation rooms, which also helps people feel more comfortable and, private.
Yeah, sometimes it's those little things, isn't it? Like just having someone sitting there makes a difference when you feel a bit vulnerable. Okay, so then they got into the practical side of things. Sarah wanted to know about that first visit, how long does it actually take?
Dr. Paworn described a typical first consultation as being around 30 minutes.
Oh, okay, not too long then.
No. And it's really about, first, just talking, discussing your concerns, what you hope to achieve, then a quick look inside your mouth.
Just a look.
Yeah, initially. And they might talk about needing an x-ray, for a proper screening underneath the surface.
Right.
But Importantly, it's about developing that care plan together based on your goals. And he stressed the flexibility. If you want to take it slow, maybe break things down into shorter visits, that's fine too.
So it's not like they pressure you into treatment on day one.
Not at all. It's very much a collaborative discussion first.
Okay, now this next part I found really interesting. Sarah admitted that even just a routine teeth cleaning makes her nervous. And she asked if sedation could be an option even for that.
Yes, and this is such a key point because I think a lot of people assume sedation is only for major surgery.
Yeah.
Exactly. Fillings or root canals or something.
Right. But Dr. Paworn stated very clearly, yes, sedation, both the oral kind, the pill, and nitrous oxide. Laughing gas is actually a common option at BIDH, even for routine stuff.
For cleaning, seriously.
Seriously. For scaling and polishing, especially if you're anxious or if you have sensitive teeth or gums.
Wow. Scaling and polishing, that's just the standard professional clean-up.
Yep, the thorough cleanup. So the big insight here is that modern dentistry is breaking down that fear barrier, even for the basics, like a cleaning, by offering things like laughing gas.
That's huge.
It means you don't have to just, white knuckle it through a checkup if you find it stressful.
That is something I genuinely think most people don't realize, that sedation isn't reserved for the big, scary procedures.
Yeah.
It can make those regular cleanings, which are so important, right? Way more manageable if you get anxious.
Absolutely. So Sarah, understandably, then asked him to sort of walk her through it. Like, what actually happens if you get your teeth cleaned with nitrous oxide?
Yeah, step by step.
And he gave a really helpful breakdown. Basically, when you arrive, you just let the front desk team or the screening nurse know you're anxious and interested in sedation for your cleaning.
Okay, so you just mention it.
You just mention it.
Yeah.
They note it down for the dentist. Then, for the laughing gas, the dental assistant gets the room ready, a nurse checks your vitals, pulse, oxygen, that sort of thing, and they monitor you throughout.
Right, safety first.
Definitely. Then they place this small, soft mask just over your nose. You breathe in a mix of oxygen and nitrous oxide.
And what does it feel like?
Well, he said within just a few minutes, you start to feel really relaxed, kind of less aware of what's going on, less bothered by the sounds or sensations. Some people say it feels like floating or feeling warm and comfortable.
But you're still awake.
Oh, yeah, totally conscious. You can still hear and respond.
Yeah.
And crucially, they can adjust the level up or down depending on how you're feeling.
Okay.
Then the hygienist does the cleaning, the scaling and polishing, and they'll be extra gentle if you've got sensitive spots, maybe use some extra numbing gel if needed.
And how long does the cleaning itself take?
Usually around 30 to 45 minutes, he said.
Yeah. And afterwards?
Afterwards, they switch you back to breathing just pure oxygen for a few minutes. That helps clear the nitrous gas out of your system really quickly.
So you don't feel weird afterwards?
No, apparently the effects wear off very fast. No lingering grogginess. He said you can pretty much just get up and go about your day as normal.
Wow. You could literally go back to work or whatever.
Seems like it, yeah.
That really takes the mystery out of it, doesn't it? Makes it sound much less daunting.
Definitely.
Okay, so finally, Sarah, because she's an expat in Bangkok, asked about international patients. Does BIDH see many people like her?
And Dr. Paworn's answer really underscored their international focus. He said over 60%, so the majority of their patients are international.
60%, wow.
Yeah, it's a mix. Expats living there, diplomats, business travelers, and also medical tourists coming specifically for dental work.
Okay, so they're very used to it.
Extremely. He mentioned they have English-speaking staff throughout, dentists often trained internationally, and their treatment plans meet global standards. Basically, international patients are very well catered for.
Right.
And I think this points to that broader trend, dental practices becoming much more patient-focused, really tuning into diverse needs and anxieties. There's a growing awareness, it seems.
Yeah, it really paints a picture of a place that's set up to handle all sorts of people and their specific needs, especially anxiety. So if we zoom out, what's the main takeaway here?
I think the big picture is dental fear is super common. Lots of people feel it. But, and this is the important part, it's also really manageable now.
Right. It doesn't have to stop you.
Exactly. Modern dentistry, like we heard in this conversation, offers so many solutions. It's about communication, creating a supportive environment, and having these sedation options available.
Even for routine stuff like cleanings.
Even for cleanings.
Yeah. It really highlights that proactive approach, doesn't it?
Yeah.
Addressing the anxiety head on, making sure you feel heard and respected and, well, as comfortable as possible.
Absolutely.
So as you're thinking about this deep dive, here's maybe a final thought to consider.
Yeah.
If something vital like dental care which causes fear for so many, can actually be made less scary just by understanding the options. Well, what other parts of your life might be held back by fear unnecessarily?
That's a good question.
And how might just exploring the possibilities, understanding your options in those areas, also lead to some positive changes for you?
That's really powerful. If you've struggled personally with dental anxiety or you know someone who does, maybe this conversation encourages you to just look into it, see what options are out there with modern dentistry.
Yeah, it could be that first step towards feeling healthier and honestly just more comfortable.
Couldn't agree more.